Hello and welcome to another stop along the Nittany Health virtual tour for 2020. Today we're here with Kevin Wilson, MD, Nittany Physician Group Orthopedics. He's joining us live from Blue Course Drive in State College. Welcome, Dr. Wilson. It's great to have you here.
Thank you. Thanks for having me. It's good to be here.
Great. Dr. Wilson, let's start by introducing you. Can you tell us a little bit more about yourself and what you do here at Nittany Health?
Yeah, so I grew up down the road in Hollidaysburg, PA. It took me a while to get back, but we finally came back about last year. I spent 5 years practicing in the Navy, primarily down with the Marines at Camp Lejeune. And then I spent a year in Pittsburgh doing fellowship. So it's good to be here with our team. I joined a great team with Dr. Suey, Martin, and Spencer here at Mount Nittany Physician Group. They've had a great reputation for trusted care, so it's a nice team to join. My focus is a little different. We have a mix of all types of things we do, but my focus is orthopedic sports medicine. Essentially, it's treatment of sports and work-related injuries, the special interest in cartilage surgery, and arthroscopy of the shoulder, elbow, hip, knee, and ankle.
Okay, very good. Thank you. Today we'll be talking with Dr. Wilson all about sports medicine. If you have a question related to sports medicine regarding injury, treatment, or prevention, please type it in the comment section below and we'll do our best to answer those during our short time together here this afternoon. To begin, Dr. Wilson, let's take it from the top. Please explain the term sports medicine to us. What does it mean and how does it work?
Yeah, that can be confusing. So technically we focus on in orthopedic sports medicine, the surgical care of musculoskeletal injuries from sports. It can also involve non-operative care of anything in the musculoskeletal system and injury prevention. So that requires a big team. Sports medicine encompasses orthopedics, primary care, physical therapy, occupational therapy, radiology, athletic trainers, strength and conditioning, emergency services, and cast and brace technicians. So it's a big team. And it's a fast-growing field in healthcare because the principles of sports medicine apply to just about everybody.
Mm-hmm. Very good. Along those lines, I'm wondering if you can tell us what kinds of patients do you typically see?
Yeah, so it's not just athletes. In reality, sports surgeons treat anything that's getting in the way of what you want to do or keeping you from your job or sports. So a corollary to the military, we would operate on our service members and try to get them back to work. It's not all sports. Same thing here. We have a lot of injuries from sports. We also have a lot of injuries from work. Anything that gets in the way of fitness, sports, hobby, jobs, or even just pain interfering with your daily life. Those are the things we see. Our job is to be a partner and help you perform in whatever it is you want to do.
Okay, very good. What sort of treatment options do you provide? Certainly surgery. Are there others that you offer?
Yeah, again, the sports medicine involves a big team. The treatments can be surgical or non-surgical. We get help with the non-surgical ones commonly from our physical therapists. And here at Nittany, we have a great group of therapists at Fit for Play. They really specialize in individualized, customized care. So they're good partners to have. In addition, we work frequently with athletic trainers. We've worked for years at Bellefonte, Bald Eagle, Penns Valley, Phillipsburg, where they're trainers. And we see a lot of their athletes that get referred in for fractures or sports-related injuries. Also, our sports division here at Mount Nittany has grown this fall, and we will add athletic trainers to our team directly. We'll be servicing the State College Area School District with their athletic trainers. So we look forward to getting them plugged in with our team. So they'll help us out here in the orthopedic clinic as well as physical therapy. So that's an exciting development for us this fall.
Yeah, that's very exciting. Thank you. So as an orthopedic surgeon, we're wondering, what is the most common type of surgery that you find yourself performing at Mount Nittany Health?
Since I've been here, the most common thing, and it's not surprising, is rotator cuff and shoulder surgery in general. Rotator cuff tears can be from an acute injury like a fall, or it can be from overuse. They're also commonly seen in aging adults in general. So Dr. Brian Spencer and I, we both kind of treat these the same. It has to be customized. It depends on the tear type. It depends on your activity level.
Mm-hmm.
Surgery can be involved. We also recommend a lot of non-operative treatment options first, and that can involve injections, medications, physical therapy programs, home exercises. So we try to incorporate the team and give each patient exactly what they need when they need it.
Mm-hmm. Okay, very good. So as the fall sports season starts up, what type of injuries do you commonly see among our young athletes in the community?
Yeah, with the fall sports starting up, we've been busy with simple sprains and strains and some fractures. One of the most important ones, and the things we see and have the biggest conversation about, is ACL injuries. The ACL is critical to knee stability. It's on everybody's mind when you see a sports injury in high school, or even when you're watching TV with the pros in college.
Mm-hmm.
So that's a big one. It's always a big discussion.
Mm-hmm.
The ACL is critical to stability, and for young active patients, it usually requires surgical treatment.
Mm. Okay. And are all ACL surgeries the same essentially, or do they vary from patient to patient?
It definitely varies. It's a recurring theme, I guess.
Hmm.
ACL surgery depends on the age of the patient or activity in general. It all comes down to the graft. So the graft, usually for young active people, will be your own tissue. The ACL has been attempted to be repaired in the past, and it's a historical failure. So typically, we use tissue to recreate the ACL. For young, healthy patients, it can be the quadricep tendon, the patellar tendon, or hamstrings, and we talk about all those options.
Mm-hmm.
In very select cases like revisions, when we have to redo it, or in older patients, cadaver tissue or allograft tissue or donated tissue remains a good option. So last year in Pittsburgh, we talked a lot about this, and I really do believe in Freddie Fu's simple principle of individualized anatomic ACL surgery. So he's saying for each patient, you got to pick the right graft, and then we do our best to recreate the anatomy surgically.
Mm-hmm.
And therapy is usually customized as well.
Mm-hmm. How long does it take a patient to recover from that surgery?
That's a good question. It depends what you're getting back to. For work, I mean, you can get back to walking as short as a couple weeks. For sports and things like that, it's more, really should be 9 to 12 months. We can talk about 6 months, but again, it's an individualized case, and it depends what you want to do.
Okay. Very good. Thank you. Dr. Wilson, as we mentioned, it's back to school season. It's fall, and for some that means back to sports. What tips do you have for us to help ensure a healthy school and sports season?
Yeah, that's a big question. It's all about strength and conditioning and getting ready. Hydration is important as well. So for the kids, it's getting with the athletic trainers, appropriate conditioning, and ramping up activities smartly. Then mid-season, hydration and paying attention to technique will help reduce injuries for sure.
Mm-hmm. And then it's a new day with COVID-19, so I'm sure that's on your mind as well. What tips do you offer for dealing with COVID-19 and sports injury prevention for your patients?
Yeah, it's definitely a different year. It's challenging, and I can say that we have athletes coming in, so there's sports going on out there. I think the leagues and the schools have a big challenge on how to balance risk. A lot of that's out of our hands, so we're here to support and navigate with our athletes and our leagues and our schools. Everyone can do their part. Stay healthy, keep your distance when you can, wash your hands, all the usual stuff that everybody's recommending. It makes sense. Masking is important too, and how that plays into sports is different for every sport, but pay attention to the coaches and trainers, and we'll just try to navigate safely.
Okay, very good. I'm wondering if there's any types of common preseason versus midseason injuries that you see, and maybe some tips to avoid those, if you don't mind.
Yeah, I think it goes back to the ramping of activity smartly, but we do see evidence of the difference. Mid-season are the more collision, higher energy injuries, athletes at the peak of their performance. But in preseason, we see all the soft tissue, like strains and sprains, a lot of hamstring pulls and tears, a lot of groin injuries. And that's related to strength and conditioning and preparation and hydration. So I think the key is to escalate your activity smartly, be aware of the risks, and
Mm-hmm.
keep moving towards midseason.
Mm-hmm. When you say the term condition before you play, which sounds so important, can you tell us what you mean by that?
Yeah, it's tough. Everybody wonders pain in game and things like that.
Yeah.
Certainly, physical pain is seen with training. It's soreness is a part, but I think it's important not to continue to push through pain. Overuse injuries can happen, so I think it's best to avoid that. So if you are sore, time to change the activity. Don't forget active rest, where you're doing a stretch or core workout. Change the game a little bit. Take some time for meal planning and scheduling your workouts smartly, so you can keep going through the whole season.
Okay, that's great. Very helpful to our viewers. Thank you for those tips. Now we'll turn to viewer questions. We'll start with questions we received ahead of today's live chat. And as a reminder, we're chatting live with Dr. Wilson from Nittany Physician Group Orthopedics. If you have a question for Dr. Wilson regarding sports-related injuries, prevention, treatment, please go ahead and type that in the comments section, and we'll try to answer those today. But starting with some questions we received in advance of today's live broadcast, the first question is this: what is a meniscus tear, and does it always need surgery?
That's a good question. We spend a lot of time in clinic with our patients, educating, talking about meniscus tears. They can occur at any age, and the treatment can vary based on the tear type, and the patient, how old they are, how active they are. Some tears are related to sports injuries, and they may require surgery. Others are wear and tear injuries. They all should be looked at very carefully. We do know that meniscal tissue, our knee ages, and it becomes more susceptible to tears as we age.
Mm-hmm.
Treatment should be customized. So we look at each patient. We look at the tear often on advanced imaging like MRI. And based on the pattern, we recommend treatment.
Mm-hmm.
Surgical treatments, there's some absolutes. If there's a tear in a particular place that we think will heal and we can save the meniscus and function with surgery, we do recommend it. So that would be a repair, and that's a more extensive rehab. Other meniscal tears are more of a nuisance. So there's a flap that's blocking motion or causing recurrent swelling. Those can be treated with surgery too, and that's a little quicker recovery. Other meniscus tears we can treat non-operatively. That may be injections of anti-inflammatories. Some of the biologic injections like platelet-rich plasma can help augment physical therapy and rehab for those.
Very
so it
good.
really varies.
Yeah, okay. We actually just got a viewer question for you, continuing on the topic of meniscus tears. The question is this: is it possible that after surgery to remove a tear that it can reoccur?
Yes, especially if that tear is kind of a wear and tear or aging-related kind of tear pattern. The goal of surgery is to do one surgery and do as little as we can to make it as good as it can be and avoid recurrence. But it can happen. You can tear a different portion, you can tear in a different manner. So, it's a different episode, deserves the same attention.
Okay, very good. Thank you. And thank you, Victoria, for your question. Next question for you, Dr. Wilson, is this: for older adults, what is your best advice for staying injury-free?
Wow, there's a lot to talk about there. Staying fit is incredibly important. I think we kind of lose sight of the importance of diet and weight management. I think things like appropriate diet, watching your weight, and avoiding nicotine and things like that are better than any medicine or surgery or intervention that we can do here in orthopedics. So I'd start off on the right foot and get the principles lined up before you entertain any exercise and things like that.
Okay, very good advice. Another question for you: how do you know when to take your child to your office at Physician Group Orthopedics versus an urgent care center versus the emergency room whenever they have an accident or injury? What are some things to watch for, and how do you make the decision?
And that can be complex as well, but I think basically we work very closely with our pediatricians. So for parents of young children with this problem, the pediatrician is a great resource. We talk to them all the time. We keep a close relationship. So we can help them help you direct traffic and get you into our clinic when we need to. Urgent care can be helpful. The question is whether they need an x-ray or an evaluation by a provider. If the child is reluctant to put weight on their leg or foot, it probably ought to be looked at by one of us. In the same sense with the upper extremity, if there's a fracture and they don't want to use it and it's swollen, that kind of a sign of the fracture. So we should probably take a look. And there's cases where it's obviously deformed and swollen, and that probably go to the ER. It's extraordinary pain, and you can't wait. Go to the ER, and they'll get a hold of us if they need us.
Yeah, very good. And it's also a good time to remind that the ER at Mount Nittany Medical Center is offering virtual visits. So without ever leaving your home, you could click on mountnittany.org, click on the virtual ER visit, and start a visit right from your home, if appropriate, of course.
Yeah, that could be a good screening mechanism.
Great. Final question for you here today before we let you go. The question, and you touched a little bit on this earlier in our chat, when it comes to working out, do you believe in the saying, no pain, no gain? Is pain a normal part of a healthy exercise program, and how much is too much?
That's a fine line, complicated question. But again, I think we touched upon, as you said, we expect some soreness. That's good. You're working out. Change it up. Try not to push through that pain. It certainly is a fine line. And I think if you find discomfort that's getting in the way of progress, despite cross training and active rest days and things like that, that's when we can be helpful. We'll take a look and see if it's something we need to take care of with you.
Okay, very good. Well, that's about all the time that we have today. So thank you, Dr. Wilson, for your time and for answering all of our questions. We're so glad to have you here today. And thank you to all of our viewers for tuning in. As a reminder, please be sure to follow our Facebook page for our next virtual tour stop. We have one more coming up. You won't want to miss it. And for more information about the services we featured today, please be sure to visit mountnittany.org. Thanks again.
Thank you.